Out of balance loading occurs when the weight distribution of a helicopter causes the center of gravity to fall outside of the manufacturer's specified limits. The center of gravity is the point where the helicopter's weight is balanced in all directions. If the center of gravity is too far forward or too far aft or too far to the sides, it can make the helicopter difficult or even impossible to control safely. Let's talk about how does out of balance loading affect the helicopter in specific conditions. If the center of gravity is too far forward, the helicopter may have difficulty raising the nose, especially during takeoff and landing. It can also make forward flight unstable because the helicopter will naturally pitch nose down. This could require excessive aft cyclic input to maintain level flight, which reduces your control margin. If the center of gravity is too far aft, the helicopter may become tail heavy, making it difficult to lower the nose, particularly during auto rotation. This condition can also cause the helicopter to be less stable in forward flight. If the load is not evenly distributed side to side, the helicopter will tilt to one side. This requires constant lateral cyclic input to keep the helicopter level and can lead to control difficulties during critical phases of flight like hovering and landing. Let's talk about reduced performance. An out of balance helicopter often requires more power to maintain stable flight. This increased power demand can reduce the overall performance of the helicopter, making it harder to climb, hover, or maneuver, especially in high density altitude conditions like hot weather or high elevations. Maintaining control of an out of balance helicopter requires constant adjustments. The pilot must continuously compensate for the imbalance, which increases the workload and fatigue, particularly on longer flights. This can also increase the likelihood of pilot error, especially in stressful or emergency situations. Lateral imbalance can increase the risk of dynamic rollover, a condition where the helicopter can tip over on its side during takeoff or landing. If one skid or wheel is stuck while lifting off or landing, the helicopter imbalance can cause it to roll over rapidly. Always perform a weight and balance calculation before flight. This includes consideration for the location of all passengers, cargo, and fuel. Distribute weight evenly. Place heavier items closer to the center of gravity and avoid placing too much weight in the tail or the nose. Recheck balance if you make significant changes during the flight, like dropping passengers off or using up fuel, especially if the helicopter fuel tanks are located far from the center of gravity. Know the center of gravity limits of your helicopter and never exceed them. It's not just about staying within the weight limit, it's also about how that weight is distributed in the helicopter. Think of the helicopter's balance like walking a tightrope. If you're perfectly balanced, it's smooth sailing. But if you're off balance even a little, it becomes wild and dangerous ride. So always take time to ensure your helicopter is balanced correctly. Your safety depends on it. If you're ready to dive deeper into the world of helicopters, check out the free Getting Started helicopter course in the description below. And as always, please feel free to like and subscribe.